We focus on the patients we have. If you see fewer patients, your diagnosis should be more, not less. It's a mindset thing. So we think, well, we're seeing fewer patients, so our diagnosis goes down because there's fewer conference exams. Well, no, actually, it means we're less stressed and not rushed, and so there should be twice as much diagnosis coming out of those visits. So it's 100% a mindset thing, okay? So we want to stay strong on expanding opportunity. I assume in the morning huddle, you all talk more than you do with me, and you're focused on what's the next level of growth for a patient's health. Every patient, what's next? If there's absolutely nothing next, they're impeccable through and through, 100% of every aspect. They have zero pockets. There's no recession. Their teeth are naturally, dentition it's unvarnished, it's completely restored the way it's supposed to be. All the teeth exist in their mouth, and their occlusion is so perfect. You can see it from a mile away. Hey, if all these things are true, okay, then we have referrals, testimonials, okay, maybe some other stuff. Maybe you want to sell them a water pick or something. Okay, so you have to think about what's the next layer of health for every patient. So I just want you to, plant more seeds here in the spring, and we just double back down on creation. Now, the second aspect of this is making sure that in this very meeting, for example, okay, you need some time where we're looking out ahead. Now, if we got holes in the next 2 weeks, well, we better deal with that first. But we should be looking out, where's our next new patient availabilities? Do we have holes in hygiene already, or do holes just happen like day of or 2 days before? So then we can improvise. Can we pull somebody off restorative and double dip? Okay, could we bring in new patient, accelerate into new patient side? Could we speed up some perio programs and bring them into these holes so they don't have to wait till later? Like, improvise. But we don't want to spend so much time trying to ram the schedule full that we're missing, what's in front of us. Okay? So those are just 2 points. Where are you taking this patient, right? That's got to be the question. It's not the treatment that exists that we can see. It's the treatment that that we don't know of yet. So always prioritize new x-rays, new photographs. And I want you to also discipline this idea. If you have unscheduled treatment, take a new photograph of that treatment. Old treatment, new picture equals new treatment. And so at the very least, assistant and hygiene team, we know what we're doing. So even if you could grab the intraoral and say, well, patient, we're doing a little bit on this side, lower left. And now if the lower right has already been talked about, let's say last week, and they're doing lower left, then it's easy. It's easy. But if it's old, if it's outdated treatment, take a new picture, show it. Okay, this is what we're doing on this side today, but over here, we have other things we need to schedule you before you leave. I already told you this before, but it requires some habit, okay? The habit goes like this. When we first sit the patient in the chair, first of all, you go up there, you get him. As you're walking down the hall, you're being so nice and saying wonderful things, okay? And then you sit in the chair. That's the flight switch. That's the flip, okay? You say, patient, okay, I just wanted to reemphasize how happy I am that you're here today. We're very excited. The fact that you're valuing your health, okay, you're putting yourself first is a great thing. I want to just walk through the visit we're going to have today. And then if you're in hygiene or you're doing dentistry, either which side, you say, here's what we're going to do. Blah, 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 blah. And in addition to that, we have an opportunity to take some updated pictures. We're going to do new x-rays today. Or in addition to that, there was also a couple things left on your pathway to health that we need to make sure we get scheduled before you leave. It's just a matter of fact. If there's treatment, has to be scheduled. We don't say, we're going to revisit this. We're going to take a look. I know the doctor's going to want to check in on such and such. No, you say, and as you remember, last time you were here, we've been monitoring over here on this section. We have to get it scheduled so we get it done. We talked about you in our morning huddle today. No disease is okay. So the point is, while you're sitting the patient down preparing, you immediately, it's like 10 seconds, and you just tell them. You ever heard this expression? Tell them what you're going to tell them. Tell them what you told them. It's an old speaking shortcut. Okay, so we tell them what we're going to tell them. We tell them. We tell them what we told them, and that's basically what we're doing here. We're taking the visit full circle in their minds. Okay, praise and appreciate first. So now, tomorrow morning, everybody has to know the patients of the day. What are we doing with these people? Okay, what's the next step? What's the opportunity? What can we do to be? By the way, education is creation. Okay, so this is a good thing for the patient. We're not, selling them anything, although we love to. We're educating, and educating is creating. Don't worry about what you don't have. Don't focus on what isn't there. Focus on what is. And then do the best you can with that. And that will, create a flow of abundance again for you.